talk about precordial kick syndrome. Akira.
Puja.
Alright. Objectives, we'll talk about some problems and the interventions to fix them. For review, we got precordial kick syndrome is characterized by sharp, stabbing chest pain that usually occurs on the left side. It occurs most commonly in children and adolescents, and the pain occurs at rest or with mild to moderate exercise, and it's usually worse with inspiration. The pain usually lasts about 30 seconds to 3 minutes, and the overall cause is unknown, but it seemed to be associated with bad posture, and it is thought to originate from irritation in the pleura. Okay, so for problem number 1, we got postural imbalances. So for the maximum protection phase, the intervention could be thoracic extension, scapular retraction, and this would be for reducing pain and muscle tension and to regain the proper alignment. And then for the moderate protection phase, we can do wall angels or thoracic mobility exercises. And then we would do this to promote posture, flexibility, and pain-free movement. And in the minimum protection phase, we could do cervical stabilization or dead bugs. And we do this to build strength, postural control, and improve stability. So the first one we'll show you is the thoracic extension. So I'd have my patient sit in the chair. Put your hands behind your head. And you're just gonna gently bend backwards. And then go back to neutral. And you would do this. Hold it 5 to 10 seconds, and then you do that like 5 to 10 times. And for the second exercise, we could do some thoracic mobility exercises. So I'm gonna move the chair. There you go. You're gonna sit down. Right, yeah. You're gonna put your hands on the mat and pretend you got pulling you towards the ground, and you're gonna fall down into that until you feel a stretch back here and in your triceps. And hold that 5 to 10 seconds, come back up, and then you can do that 5 to 10 times. Great job. And then for the last one, the minimum protection phase, we can do cervical stabilization exercises. So I would have him get the band and hold the ball against the wall, and then he can just externally rotate. Yeah. You do that like 5 to 10 times, and then take a break and do that 2 more times. Okay. Oh, these are some pictures of what we just did and the ones we didn't do. Breathing dysfunction is the next problem. So a lot of times these people struggle with breathing, and it causes shallow breathing patterns as it's happening, and they may have anxiety because of the pain. So these relaxation exercises can help individuals improve breathing mechanics and improve their comfort level. So for the maximum protection phase, we could do diaphragmatic breathing, deep breathing exercises with relaxation, and then we would do this to encourage deep breathing and reduce muscle tension. For the moderate protection phase, the intervention would be thoracic breathing, breathing with movement, and we would do this to increase thoracic mobility and start to promote breathing with movement. And then for the minimum protection phase, the intervention would be box breathing and breathing during functional activities, and then we would do this to increase the breath control during everyday activities. So the maximum protection phase, we're going to show you, we can do deep breathing exercises with relaxation, since we already saw the diaphragmatic breathing. So I guess I can sit or lay down. You can sit, why not? And they can breathe in for 4 counts, and then hold it, and then breathe out for like 6 counts, and try to relax all your muscles while you're doing this. And they can do that like 5 to 10 times. They breathe in through their nose and out through their mouth. Right. Great job.
Alright, for the moderate protection phase, we have 2 exercises. We have thoracic breathing, which is the opposite of diaphragmatic breathing. They're going to breathe into their chest, and we're going to tell them to put their hand on their belly, so they're not breathing into their stomach or with their diaphragm. This is going to help open up their chest, which is going to help with chest expansion. Then we have breathing with movement. This involves controlled breathing with slow, controlled motions. The goal for this phase is to ultimately improve thoracic mobility and promote proper breathing patterns while moving. In the minimal protection phase, we have box breathing, which is basically 4 seconds in, hold for 4 seconds, exhale for 4 seconds, and then hold again, and then repeat the process. Then we have controlled breathing while doing functional activities. For this, I can have my patients simply just walk while breathing in and out slowly through their nose and out through their mouth. The purpose of these 2 interventions is to improve breath control, specifically during functional tasks. So for the moderate protection phase, I'm going to have my patient do controlled breathing with movement. So go ahead and sit for me. Alright, so I'm just going to have her flex her shoulders up, both bilaterally, while breathing in, and then when she goes down, breathe out. So in through her nose, out through her mouth. Alright, for the maximum protection phase exercise, we're just gonna have my patient walk while breathing the same technique, in through the nose, out through the mouth. We have fear of movement. Fear of movement is common with patients with PCS. As symptoms appear, some patients may be too afraid to initiate movement, when movement is one of the fastest ways to relieve symptoms. For the maximum protection phase, some of the interventions we can do is gentle range of motion of the arms, neck and legs, as well as diaphragmatic breathing, which we went over. These will help promote body awareness, which will help reduce symptoms as well as reduce any anxiety the patient may have towards movement initiation. And we have the moderate protection phase. For this phase, we can do gentle marching in place, as well as some arm circles. These exercises will help the patient to start moving more without the fear of movement, which will help increase their confidence towards movement. And then lastly, we have the minimal protection phase. In this phase, you can do squats, heel raises, or simply just walk like we just did. These exercises will help strengthen muscles that are necessary for movement initiation and encourage full body movements, ultimately making the practice motions easier and less scary to the patient. Alright, for the maximum protection phase, I'm going to have my patient perform abduction, shoulder abduction, while doing the same breathing technique. Slow and controlled. Moderate protection phase, we can do some arm circles. So you can do seated arm circles. And these are good for opening up the chest, and they actually help relieve symptoms really quickly. And then for the last phase, the minimal protection phase, we can have my patient do some mini squats. So go ahead and stand behind the chair. Squats, and these help with initiating, getting up. Getting up helps to improve blood flow throughout the body and relieve symptoms as pretty much as soon as they appear.
These are exercises, and these are repetitions.
specifically with the fear of movement, how would you ensure there's carryover as they go home or to the caregivers of the patient?
I would educate them that movement is the best way to relieve symptoms. It helps open up the chest, especially like the arm circles, shoulder flexion, shoulder abduction. That's gonna help the rib cage expand. That's really where you want to basically get rid of PCS.
So with the cervical stabilization exercise, the external rotation part, how important is that as far as what you're trying to accomplish?
You can do different movements. You don't just have to do that. You can also do like weights in different directions. It's just to get basically the cervical spine to stabilize while doing different activities. Dr. Carter.
Which upper extremity PNF pattern would you incorporate for chest expansion, rib expansion, and improve posture for breathing?
D2.
Why D2?
Because it incorporates flexion and external rotation. That's really good for PCOS.